Have you ever wondered why conversations about female anatomy still feel so awkward, even in our modern world? Why do so many of us, whether we grew up with female bodies or share intimacy with someone who has one, still feel uncertain about what's happening beneath the surface? Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you've ever had questions or concerns about urological health, yours or someone you care about, stay with us. We're here to help you understand your body with clarity, compassion, and without any shame. Today, I want to share 5 facts about female anatomy that might genuinely surprise you. These aren't just interesting details. They're insights that can deepen your understanding of how beautifully complex and adaptive the female body truly is. So let's dive in together. Before we explore these facts, let's take a moment to acknowledge something important. Much of what we think we know about female anatomy comes from fragments, health class diagrams, whispered conversations, or images that have been digitally altered beyond recognition. The truth is, female bodies are far more intricate and remarkable than most people realize, and yet many individuals, regardless of gender, go through life feeling disconnected from this knowledge. Some feel embarrassed to ask questions. Others have been taught that certain topics are simply too personal to discuss openly. But here's the reality. Understanding how the body works isn't shameful. It's empowering. It helps us communicate better with partners, recognize when something might be wrong, and appreciate the incredible design of human biology. So, whether you're someone navigating your own health, supporting a loved one, or simply curious about how the body functions, these 5 facts might shift the way you think about female anatomy entirely. Let's start with something that often surprises people. The clitoris and the penis are, quite literally, the same structure, at least in the beginning. When a fetus is developing in the womb, there's a period where no external genital differences exist yet. Both male and female fetuses have something called a genital tubercle. Around the 10th week of development, depending on genetic signals, that tubercle will either become a penis or a clitoris. But here's the key. They remain homologous structures. That means they share the same embryological origin, the same tissue composition, and remarkably similar functions. The clitoris contains corpora cavernosa, the same erectile tissue found in the penis. When aroused, it fills with blood and expands just like an erection. In fact, recent research from Oregon Health and Science University found that the clitoris contains an average of over 10,000 nerve endings. That makes it one of the most sensitive structures in the entire human body, and the only organ we know of that exists purely for pleasure. Think about that for a moment. The human body, in all its complexity, designed something whose sole purpose is joy. That's not trivial. That's profound. And yet, many people have never been taught this. Many don't realize that the clitoris isn't just a small button at the surface. It's actually a much larger internal structure that extends deep into the pelvic region, with branches that wrap around other sensitive areas. Understanding this can transform intimacy. It can help people communicate more effectively with their partners, recognize what brings them pleasure, and let go of outdated myths that have caused confusion or shame for generations. Just like the penis has a foreskin, the clitoris has something called the clitoral hood, or prepuce. Its job is to protect the highly sensitive glands of the clitoris from irritation, infection, or overstimulation. Now, here's something many people don't realize. Sometimes, the clitoral hood can develop adhesions. This happens when dead skin cells, natural oils, or other buildup cause the hood to stick to the clitoris itself. In men, this would be similar to what's called smegma, a harmless but uncomfortable condition. For some people, these adhesions cause no symptoms at all. For others, they can lead to discomfort, tenderness, or even difficulty experiencing pleasure or orgasm. If this is something you've experienced, please know, it's not uncommon and it's completely treatable. There's an in-office procedure called clitoral adhesiolysis, where a trained provider gently separates the hood from the glands. It's quick, typically well tolerated, and research shows that most people report significant improvement in comfort, arousal, and overall satisfaction afterward. I share this not to cause alarm, but to remind you that if something doesn't feel right, it's okay to seek help. Your body deserves care, not silence. Let's talk about the labia minora, the inner lips of the vulva. These structures are as unique to each person as a fingerprint. They come in every shape, size, color, thickness, and texture imaginable. Some people have labia that are tucked neatly inside the outer lips. Others have labia that extend beyond them. Some are symmetrical, others are not. Some are lighter in color, others darker. And all of this, every variation is completely normal. Unfortunately, many people grow up believing their anatomy should look a certain way, often influenced by digitally altered images in media or unrealistic portrayals in adult entertainment. This has led to a troubling rise in requests for cosmetic procedures that, in many cases, aren't medically necessary at all. So let me be clear, if your labia are asymmetrical, if they extend past the outer lips, if they're darker or lighter or textured, none of that means something is wrong. You are not broken, you are not abnormal, you are you. Now here's something else you might not know. During arousal, the labia minora can swell to 2 or 3 times their usual size. They may also change color, often shifting from pink to a deeper red as blood flow increases, especially just before orgasm. And then, after intimacy, everything returns to its usual state. The body is adaptable, responsive, and perfectly designed to do exactly what it does. If you've ever felt self-conscious about how you look, I want you to hear this. Your anatomy is not something to be ashamed of. It's something to understand, appreciate, and trust. Here's a fact that often surprises people. The vagina is not a fixed structure. It changes, dramatically, depending on the body's state. In a non-aroused state, the vagina is typically about 3 to 4 centimeters wide and 8 to 9 centimeters long. But when arousal occurs, something remarkable happens. The walls of the vagina send signals to the brain. Blood flow increases. Natural lubrication begins. And the vagina itself expands, both in width and length, to accommodate intimacy. In some cases, it can nearly double in size. This is called vaginal tenting, and it's one of the body's most elegant adaptive responses. It prepares the body for comfort, reduces friction, and supports pleasurable connection. And then after intimacy, everything returns to its usual state. There's no permanent change. There's no such thing as a vagina becoming loose from having sex. That's a myth, one rooted in misunderstanding and, unfortunately, used to shame people for their choices. Your body is resilient. It's designed to stretch, adapt, and return to baseline. That's not a flaw. That's brilliance. If you've ever felt insecure about how your body responds during intimacy, please let this be a reminder. Your body knows what it's doing. Trust it. Finally, let's talk about something that might shift the way you think about vaginal health entirely. The vagina is self-cleaning. That's right. It has its own natural ecosystem, complete with beneficial bacteria that maintain a slightly acidic environment. This acidity, regulated in large part by estrogen, helps protect against infections, prevents harmful bacteria from taking hold, and keeps everything balanced. Now, here's where well-meaning habits can sometimes cause harm: douching. Many people have been taught to clean inside the vagina, often with scented products or douches. But the truth is, the vagina doesn't need that. In fact, those products can disrupt the natural balance, strip away protective bacteria, and increase the risk of infections, including yeast infections, bacterial vaginosis, and even recurrent urinary tract infections. If you want to clean your external genital area, that's simple. Let warm, soapy water run over the hair-bearing areas. That's it. The vagina will take care of itself. Now, if you're experiencing recurrent infections, that's often a sign that something in the microbiome has been disrupted. One of the most effective treatments, especially for people who are postmenopausal, have had surgery, or are on medications that reduce estrogen, is vaginal estrogen therapy. It's safe, well-studied, and can restore balance in a gentle, targeted way. Here's the bottom line. Your vagina doesn't need to smell like flowers, vanilla, or anything other than what it naturally is. It's not supposed to. And if anyone has ever made you feel otherwise, please know, they were wrong. Your body has a scent. It has a rhythm, it has a design, and it's perfect, exactly as it is. So there you have it, 5 facts about female anatomy that you might not have learned in school, might not have heard from a doctor, and might not have felt comfortable asking about. But here's why this matters. Knowledge is power. When we understand how our bodies work, how they respond, how they protect themselves, how they adapt, we can make better decisions. We can communicate more openly with partners, we can recognize when something feels off, and we can let go of shame that was never ours to carry in the first place. Your body is not a mystery to be feared, it's a system to be understood, respected, and cared for. So if you've ever had questions, if you've ever felt uncertain, or if you've simply wanted someone to explain things in a way that feels clear and kind, stay connected. We're here to walk through this with you, one conversation at a time, because your health matters, your comfort matters, and you deserve to feel confident in your own skin. Take care of yourself. you're absolutely worth it.